Hello, and thank you so much for joining us for our first webinar of 2022, our World Horse Welfare Wednesday webinars. We're just going to mark time. If you've been with us before, you're joining us by Zoom. Thank you very much for joining us by Zoom. We're just going to wait for our Facebook Live followers to join us. And I'm delighted to say that we now do have our Facebook Live followers. So whether you're joining us by Zoom or whether you're joining us by Facebook Live, thank you for joining us for our first World Horse Welfare Wednesday webinar of 2022. We're into our third year of running these, and we're kicking off with an absolute cracker on the whole horse approach and how we as horse owners can make sure we have a good team of professionals supporting us and our horse. And as ever, we've got some brilliant experts with us this evening. We have Vet Lucy Grieve to give us a quick introduction on tonight's topic. And then around a panel discussion, we're going to be joined by Chartered Physiotherapist Kate Stephens, Farrier Becky Low, and Equine dental technician, if I can say it, James Arkley. Now, as before, this is very much a two-way conversation. So if you are on Facebook, then please do share the live share it on Facebook Live. If you want to join us on our future webinars, then please do. Sorry, if you want to review back the webinars we've been running since June 2020, then they're all available on our YouTube channel. Now, the format for tonight is Lucy's going to give us a presentation, then we're going to have a sort of a structured Q&A with the panel, and then we have a good half an hour where it's very much open to you. So if you are joining us by Zoom, if you can put your questions in the Q&A function at the bottom of the screen, and if you are joining us by Facebook Live, then put them in the comments function, and we'll transfer them across to Zoom. So it's really much up to you, that section, and any questions you'd like to ask. And if you're on Zoom, then you'll also be able to upvote questions that are already there that you were going to ask anyway. So please do, really do get involved in that part, and it will make it a really sort of valuable discussion. Of course, if you do enjoy tonight's webinar or today's webinar, which I'm sure you will, then please do tell your friends and family. Do tell your colleagues that all our previous webinars are available on our YouTube channel. And if you would like to suggest future webinar topics, then please do email us on education@worldhorsewelfare.org. And we're now going to be running in a fortnightly sort of rhythm through to the spring. And our next webinar is going to be on Wednesday, the 9th of February, with Vet Chris Tufnell on wound care, how to deal with a wound and when to call the vet. So to get us started, I'm going to now share my screen and just want to have a poll question with you. And the first poll question, or the poll question, is: do you routinely check the qualifications of an equine health professional before you let them treat your horse? Now, if you're on Zoom, you'll be able to take part in this. If you're on Facebook Live, then please do answer. One of the, you either never check their qualifications, or you check certain professions, but not all. You always check their qualifications, or you haven't ever thought about doing it. So there's 4 options there. And so please do take a, well, there's no right or wrong answers, and it's completely anonymous. We just want to get a feel for whether you do check them, and if so, how often. So now I'm going to introduce you to Lucy. Very much the aim of tonight is, obviously, we have our horses, and there's a lot of people who we need to rely on to help look after our horse. And so often it's siloed thinking, dealing with the vet, dealing with the farrier, dealing with the saddler. But shouldn't we use it as a whole horse approach, and shouldn't we use it as a team? And therefore, tonight's webinar is all about how we can help ourselves to look after our horses better through effectively engaging a team of support for looking after our horse. So, as I said, Lucy's going to lead us in a 25-minute presentation. And for many of you, you will know Lucy already. She was last year's president of the British Equine Veterinary Association. She's an ambulatory vet at Rosdales and has significant interest, and chairs Beavers, still chairs Beavers welfare, equine welfare committee. There's a quirky fact that you might not know about Lucy is around her diet, because when she was growing up, and I've been told by Lucy to do this in the voice of Jessie's Diets from the Fast Show, some of you might remember that, and this week she will be eating spaghetti and Parmesan cheese. I'm not sure how good that was, but she loves spaghetti and Parmesan cheese, so much so that obviously it's a genetic link because her daughter loves it too, and they get through tons of the stuff. Before I hand over to Lucy, Basil, can you give us the result of the poll? So look at that. Hardly any of you never check the qualifications, which is very good. And then equally, some of you will equally split between certain professions, but not all, and always checking them, with about a 15% having not thought about it. So basically, that's 1 in 5 haven't thought about it or never do it, and 4 in 5 do it for some or do it for all. So that's a pretty good statistic, and maybe the panel will come back and think about that and dwell on that during the discussion. So Lucy, Fast Show and all, over to you.
Thank you, Roly. Thanks, everybody. I'll just share my screen. So I'm basically going to take you through a whistle-stop tour of why it's important to choose the right team, and also what these qualifications all mean. So first of all, the team, and who are those people? So for me, the team is really all of these people, from owner, rider, trainer, through vet, person doing the feet, person doing any musculoskeletal therapy, the person doing the teeth, and then saddler and nutritionist, like Roly's already mentioned. And some of you will be using all of these people already. Some might be using only a handful of them, but it's how well you know really how to choose the right ones and when they're important. So we're going to discuss in particular these 4 today. So as you already know from the panelists, you can guess which ones they are. And before I go any further, I want to warn you, this is going to be a severe case of acronym bingo, and that is unavoidable. I don't apologise. It is the way the industry is structured. There are an awful lot of associations and qualifications, and the whole reason for today is to try and make some sense of it, because it is enormously confusing. Vets, I'm pleased to say, are probably the easiest bunch to try and get your head around. Basically, you're either a vet or you're not. It's a protected title legally. The reason for that is that, quite a while ago in the 60s, it was a law passed to try and protect animals from people mutilating them, as the words are used. So the course for being a veterinary surgeon is anything from 5 to 6 years in training at a university level, doing exams and in all species. That enables you to become a member of the Royal College of Veterinary Surgeons, where you have to swear an oath, and they will regulate you as a professional person going forwards. And if you do anything wrong, they come down on you like a ton of bricks, and you can be struck off much like a human doctor can be. Vets can specialise, and that's left up to themselves to decide in terms of their career path. But one thing that's really important to remember is that legally only vets can diagnose conditions and prescribe treatments. So anyone doing that, unless they're a vet, is it's a criminal offence. They are going against the law. Farrier. So the Ferry Registrations Act is another law that was passed that made it legal only for registered farriers and apprentices and vet students to practice the act of farriery, and that's preparing a foot to take a shoe. It's a criminal offence, again, to do anything along these lines if you're not one of those people. However, interestingly, trimming a foot on its own isn't covered by this law and therefore remains unregulated. So legally, anyone can trim a foot. So farriers undergo a 4-year apprenticeship. This has more recently started to include a reasonable amount of barefoot trimming, which it didn't before, because barefoot trimming, as you can imagine, years ago when the farriers were starting out as a profession, wasn't really that common. It was horses of work and beasts of burden that were needing to be shod. So shoeing was by far and large the greatest proportion of the work. But now barefoot trimming is becoming something that's a lot more commonly requested by owners. But they've undergone a huge amount of training. They've had to work under an approved training farrier, taken exams, and that enables them to become a diplomat or a diploma holder of the Worshipful Company of Farriers. They can go on to become associates and fellows in increasing sort of amount of work, as it were, to achieve those. And they're regulated by the Worshipful Company of Farriers. There is also a Farriers Registration Council. So they will be the ones that come down on the farriers that are not doing the work to the level that they should be. So they are quite tightly regulated and disciplined, as it were, much like we are as vets. Here's a lovely picture of Rebecca, which I thought was a very artistic view of her shoeing a horse. I thought I'd just pop that in there to show that shoeing is very glamorous, particularly where Rebecca's concerned. Then we have the non-farriers, as I've called them, which is just to differentiate them from those that have undergone farrier retraining. They're barefoot trimmers, equine podiatrists, etc. The terminology used is not protected in any way, so anyone potentially could call themselves any of those things. And there's no formal recognized training or qualifications, and there's no regulation because they don't have a body, as it were, that's regulating them and that they have to be registered to. It's also worth just noting that it's anyone can list themselves on some of the relevant websites. So there's no need to prove that you've undergone any training in order to advertise and carry out that work. Then we're going to move on to the slightly more confusing world of musculoskeletal therapy. So this becomes quite an enormous minefield to try and understand. So apologise that this will get slightly complicated, but it's important we don't try and oversimplify it, because this is why there's so much trouble in understanding who does what and who's qualified and who's unqualified, etc. Because there's a huge variation between the different qualifications. There's anything from short part-time courses through to independently accredited degrees and then postgraduate training. It's worth again noting that there are some legally protected titles involved here. So calling yourself a chiropractor, an osteopath, a physiotherapist, or a chartered physiotherapist is actually illegal unless you are qualified in those things to this certain criteria, which is degree level training. These people are legally trained to treat humans. So these are all human professions, as it were, human patient professions. They are independently regulated and they have to have insurance. But beware, okay? So any prefix that is used in front of those titles, which includes things like animal, so animal chiropractor or veterinary osteopath or equine physiotherapist, renders these titles unprotected, okay? So anyone can use those titles with a prefix in front of them. So the attention is in the detail, I'm afraid here, or the devil is in the detail, as I might say. So already we're getting a bit confused. I'm going to just go through a few of those specific, more commonly encountered professionals in the musculoskeletal world, just to try and clarify these things. But you can quiz Kate later. I'm sure she'll love to fill you in on more details if you want them. The first thing to know is that because there was so much confusion, the government and the veterinary profession and the other professions involved in this work decided to come together and create a register of animal musculoskeletal practitioners, RAMP, okay? And the idea of this was to get those people out there doing this work that were carrying out their work to a set standard and above, so that there was a basic minimum that you wouldn't be able to get below if you were working in this field as a RAMP member. So this would include physiotherapists, chiropractors, osteopaths, and there are some other animal therapists that are listed here. It is a voluntary register. Don't worry about that for the moment, but the point is that it self-regulates, okay? But it is setting standards for training courses, and it does require their members, and certainly it heavily emphasizes this to their members, that they do abide by the law, such as requesting veterinary permission before carrying out a treatment, as opposed to maintenance work, which is allowed to be carried out without any veterinary involvement. One of the main members of the RAMP list would be ACPAT physiotherapists, so the Association of Chartered Physiotherapists, so they're human physiotherapists that are working in animal therapy. They've undergone a 3-year human physiotherapy degree, which enables them to be members of the Chartered Society of Physiotherapy. They've then gone on to do a further 2-year postgraduate degree in veterinary physiotherapy. As members of the human physiotherapy world, they're automatically members of the Health and Care Professions Council. So these guys are regulated very much like the farriers and the vets are, and they're disciplined. So if they do something wrong, if they commit any sort of negligence or anything like that, or they will be potentially struck off their list, struck off their register, and it can stop them practicing. Kate is one of these, an ACPAT physio. So again, please do point your questions at her later. This is the limit of my depth of information that I'm giving you here. And it's taken some research, I can tell you. So veterinary and equine physiotherapists, they are not necessarily human trained, as we've already mentioned, and they have carried out, however, a very high level of standard training in the animal physiotherapy role. So they've done a level 6 or 7, as they call it. This is usually a 2 to 4 year degree at university level, and then they go on to become members, and they can choose who they want to be membership or who they can be members of, and that includes multiple. This is just 3 examples. I just want to emphasize that there's lots and lots of different associations, institutes, and you can join any of those as one of these veterinary or equine physiotherapists. Osteopaths, so they're slightly different. They actually discourage openly in their field the use of the animal equine prefix. So they ask that only human trained osteopaths call themselves anything that has the word osteopath in it. Doesn't stop other people doing it, unfortunately. It's still legal for other people to use a prefix, but they certainly discourage it in their field. And so they ask that anyone that isn't human trained actually calls themselves an animal manual therapist. The human osteopaths have done similar sort of lengths of training, 3 to 5 years at a degree level, and then further animal training on top of that to become members of these various osteopathy associations. And then chiropractors, slightly different, but again, there's lots of outliers. These are very much the basic rules to a lot of these fields. They tend to be either human chiropractors that have gone and done the 3 to 5 year type of length of degree course, or actually vets. So vets that have an interest in chiropractic will tend to go on and do further training and can become members of the International Veterinary Chiropractic Association. And there's a British version of that as well. They're usually members of both these people. Phew, that's the worst bit out the way, you'll be glad to know. Next, we're moving on to who can work on horses' teeth. So this is an interesting one because the Veterinary Surgeons Act that was passed actually had a part of it that said manual removal of overgrowth and sharp enamel points with hand instruments, so this is hand rasps, not anything that's motorized, can be legally done by anyone. However, in the field, you will see today that there tends to be 3 categories of people that go out and do equine dentistry, equine dental work. Those are vets, those are equine dental technicians, and by that, that's a very specific term I want to make you aware. They're either members of the BAEDT, which is the British Association of Equine Dental Technicians, or members of the Worldwide Association of Equine Dentistry. So those 2 acronyms you'll have to remember for the next couple of slides. You do get people out there who are not members of either of those associations and not vets, and therefore I've put them under the unregistered equine dentists category for now. Again, not a protected title, so anybody can use that term to describe themselves. However, dentistry at this point in the 60s, when the Veterinary Surgeons Act was being developed, got more complicated. We had realization of the enormity of what was going on in a horse's mouth with CT and MRI and X-ray even and things like that. And power tools were being developed. And it became clear that you could do more damage in a horse's mouth if you weren't trained than what perhaps somebody could do with a hand rasp, as it was seen back then. So the industry that involved vets as well, and the government and everybody decided to create these categories. Okay, so this is all going to sound a bit complicated, but there's a real reason for all of this. You have these 3 categories of dental work in horses' mouths. Okay, hand rasping is category 1. Category 2 is using any power electric tools to rasp teeth, removing any loose teeth, and she includes as well wolf tooth removal, but only under the constant direct supervision of a vet, because the next category 3, is basically anything that comes down to surgery, as we call it. So procedures that involve vascular or innervated tissue. So anything that might cause bleeding or pain, that comes under veterinary surgery and active veterinary surgery by law. So removing wolf teeth is sort of a little bit of a grey area, but there is a reason that was put into category 2 for certain individuals, as you will see. So vets, back in the olden days, didn't probably do an awful lot of equine dentistry because, as I say, no one really did. but it's now a part of formal and normal training. However, it is up to the individual after leaving vet school to go down whatever path they wish to choose, and they have to carry out the necessary training and added ongoing learning to become good at whatever it is they're doing day in, day out. They are legally, vets, allowed to do all 3 categories, and it's very clear as well, they should always act in their area of competence. So I wouldn't go out removing cheek teeth in horses. I leave that to the specialists who do that kind of work day in, day out. Although legally, I could potentially do it, it wouldn't be in my area of competence. Vets can use sedation. That's one thing that we can do. And we can also go on and do extra qualifications in dentistry. So we can go and do what's known as the BAEDT qualification, which I'll talk about in a second, or a certificate to become an advanced practitioner, or a specialist diploma, which is 3+ years and ends up normally resulting in you doing a lot more things like equine dental surgery, etc. So equine dental technicians, EDTs, as I'll call them from now onwards, are, as I mentioned, usually members of one of these 2 associations, the British Equine Dental Technician Association and then the worldwide one. BAEDT members have to undergo very rigorous training. They have to do an advanced theory course, which is run by the British Equine Veterinary Association. So they work very closely with vets. They have to do 2 years of training, 2 days a week under a mentor. Then they have to submit a huge case log of 300 cases and 50 advanced cases, and sit a very, very tough accreditation exam. They then are able to do category 1 and 2 procedures. This is James Arkley on our panel today, who will be able to represent those members and discuss how this field works on the coalface. The worldwide members, unfortunately, are a much lesser membership in this country and not as well known. I couldn't find information out about the length of training, but I do know they have 2 separate exams for the category 1 and 2 members, and then those members are on separate lists. Category 1, remember, doesn't differentiate you, unfortunately, from a lay person. So only the category 2 members, as it were, will be recognised as being above anybody that's unregulated, unqualified. So anyone that's not on one of those lists or a vet, unfortunately, goes into this category of being an unregistered equine dentist. So they may have undergone previous training under one of those associations, but if they haven't kept up their membership, unfortunately, they're not on the list, and therefore you can't guarantee what level of training they've kept up with. So category 1 only people, as these aren't allowed to use power tools. And unfortunately, we do find that there are lots of people out there doing this, but it isn't actually allowed. It's also worth noting that as vets, we're advised heavily by our associations and our Royal College to only sedate horses for members of the British Association of Equine Dental Technicians and the worldwide category 2 members. So coming to the end now, it's just to really summarize that these sorts of associations request that you do continuing professional development. That ensures that you are going to be keeping up to date, and you have to do so many hours or credits of this continual training every so many years. And that makes sure you don't get out of touch and you don't start doing things that are out of date. Okay, so that's a really important thing to recognize. Secondly, insurance. Okay, so a lot of these associations that I've mentioned require their members to be insured. That's really important. If the people working on your horse aren't insured, if something goes wrong, you could be left high and dry with paying the bills of the complications that happen afterwards. And then also, unfortunately, it's something we have to all consider, that if something were to go wrong and you felt you had to complain about somebody working on one of your horses, there needs to be somebody for you to go to with that complaint. And if someone's not registered or not a member of any association, then you're not going to have anybody to report them to, as it were. So really fundamentally, why is this team approach important? Well, clearly, the idea is that information about the horse from whatever area and profession is dealing with it needs to be fed back to some central party, because those are often connected or can be connected and can influence each other. So it's important that the owner is getting the information they need from all the professionals and that they're sharing it with the right other professionals. we obviously can't discuss an owner or a patient's information legally without breaking confidentiality. So it's important the owner drives this network of information and ensures we all find things out. It's not uncommon for me as a vet to find out that a physio has done something a few weeks ago, and that might be really critical to me making sure that horse enters onto the right path of rehabilitation and diagnosis in the first place. So we like to sort of think of this hub and spoke model, as it were, where everyone feeds in and back out to each other, but it has to come via the owner. So you guys really need to be on board with this being the model that we approach. So the take-home messages from me are: which profession are you needing to use, and to bear in mind there might be multiple ones covering that particular area or part of the horse's health. What qualifications do they hold? What memberships and association bodies are they part of? Are they insured critically as well? And if a problem is identified in any of these routine care aspects, it's really important that you get veterinary advice in order to get a diagnosis and a treatment, because it's only by doing that that you can get to the right point in finding out what's best for your horse and having that issue addressed. I'm going to say thank you there and point out that I will leave a lot of the other procedures discussed today to the others, and I'll carry on doing my acts of veterinary surgery that I prefer to be doing day in, day out, as seen here. Thank you.
I'm not quite sure what to make of that, Lucy, but there we go. Listen, that was brilliant. God, I mean, so much information in a short space of time. So I know we're going to come back to that. So, Lucy, thank you very much indeed. So now I'm delighted to introduce our other panelists. So I'm just going to share my screen in order to do that. So here we go. Sorry, I should have done that a bit more professionally. We've introduced Lucy. So now I'm going to introduce Kate, who, as we know, is a physiotherapist and has a wonderful sort of experience, having spent a lot of time within the human medicine field, over 15 years at Adam Brooks Hospital in Cambridge. She's still involved in the human medical work, but obviously now for a number of years has worked in the equine world. Something you won't know about Kate is that she was a late walker, so she used to totter everywhere. So her dad called her Tots. So if you know Kate as a friend, or all her family will always know her as Tots or a derivative of Tots. But understandably, when she went into the professional world of human medicine at Adam Brooks Hospital, it probably wouldn't be a good idea to be known as Tots. So everyone in her professional life knows her as Kate. Having said that, the madness of the equestrian world, I would have thought the nickname of Tots would be absolutely nailed on. So I think Tots as the equine physio, I think it's got a lot of mileage in it. So Kate, a very warm welcome to you. Next, we've got Rebecca or Becky Low, who's qualified farrier up to associate level, something that Lucy touched on, but she's also I think it's a trainer, ATF. Becky, you'll have to tell me what ATF stands for, but I know it means you can train apprentices, isn't it? What does ATF actually stand for?
It stands for Approved Training Farrier.
There you go, approved training farrier. I knew an acronym bingo I've just lost, but that's great. And one thing you won't know about Becky, she's obsessed with taking selfies with her pug. She has one pug, one spaniel, and 3 terriers. I think I've got those numbers right, but it's with the selfies, with the pug, that she loves taking the selfies. And when I asked her earlier, why just the pug? Because he's so squidgy. And just to show how squidgy he is, here's a picture of Becky with her pug. So Becky, it's great to have you on the panel. And finally, delighted to introduce James, who's our equine dental technician, and again has had a lot of experience in the equestrian world before becoming an EDT, both in the Army, at the Household Cavalry Mounted Regiment, but also as a BHS AI. For a number of years now has run a very successful dental business, One thing you won't know, and this is very impressive, especially being an ex-military man, I'm very impressed. He is the first military person to ride on a civilian team for Great Britain since the Second World War, when he was selected back in 2002 and 2004 to ride in the Rural Riders British event team, who competed at European Championships and helped secure 2 bronze medals for Great Britain. And he was also the only male on the team. So there you go. What an esteemed panel you've got. Now, I'll stop that sharing. Now, you're being very quiet out there. Normally by this stage, there's heaps of questions. So can I encourage you, off the back of what Lucy has talked about, and certainly off the back of the structured Q&A we're now going to have, then please do send in your questions, because this is such an important part of making sure that we're looking after our horses best by using the team around us the best. So, Kate, well, I'll come to everyone. A few sort of general questions first. But at World Horse Welfare, we for a number of years have adopted this whole horse approach. So every Tuesday, we will review the progress of the horses in our care at our 4 rescue and rehoming centres, and it will be very much a team approach, centred with the groom that is looking after that animal, but also with the vet, the farrier, the physio, the saddler, it goes on, the dental technician, as required during the course of each. So they won't all come. The vet and the farrier generally come every week, but not all the other allied professionals will come, but they'll come most weeks. But Kate, how often do you actually get to work physically alongside other allied professionals?
I'm very lucky actually, because I'm allied with Rossdale's. I get to work with the amazing team of vets there on a really regular basis. So most weeks I'm in at the diagnostic centre, seeing horses all together with the vets. I try and keep up good communication with everyone else as well. So saddlers, have a couple of good saddlers that I speak to regularly, and we, with the owner's permission, obviously share information between us as to what we feel might be going on with either the saddle or the horse's back or what have you. So I think certainly from working in the NHS as well, we have a lot of experience of working in an MDT, so it's something I'm quite used to doing.
Absolutely. And James, for you, how often would you actually work alongside other professionals when you're treating the animals in your care?
Again, I'm very lucky. I've got some great vet practices around us, and on a regular basis when we're doing either wolf tooth extraction or difficult horses, I get the lovely team around me from, I'd just say, probably 5 good vet practices around me that we work with us very regularly on a weekly basis. So yeah, we're very lucky to have that situation, yeah.
And Becky, for you, I mean, obviously, a farrier is the person who will see a horse the most, because it needs regular foot care. What can you do? In your experience, what works best so you can sort of get communication with the other professionals, including the vet, about what's best for that horse?
I think you can sort of advise owners if you feel there's something untoward, because we see them so often. We notice changes in their feet, the wear on their shoes, even sometimes the way they present themselves, as in when we're under them, if they're a bit tight or stiff, we can sort of say, oh, he doesn't seem his normal self today. Sort of see if there's any problems with the riding, and then we can advise maybe you should see the vet, get the vet to have a look, and then we can work with the vet. Sometimes we've got insurance cases if they've had a problem, and then they're advised for different farrier treatment. So we'll work with the vets in that way. I'm fortunate that I work in quite a lot of race yards, so there's a vet on site a lot of the time, and we sort of work collaboratively together. I've worked with Kate as well on different horses, so yeah, it's a real team approach, but it all from the owner really, and how they want to sort of coerce with all of us.
Brilliant. And picking up on that, Lucy, I mean, the owner, obviously, as you said in your presentation, plays a really important role here about sort of facilitating that communication. What do you do when the owner's not very good at that?
I personally will often and this isn't always preferable because it can be overwhelming for the individuals, but I personally sometimes will take that role if that person really wants me to, which doesn't mean that I'm necessarily managing their horse for them on a daily basis, but I'll certainly just ask that, you know, can they just put me in touch with who they use? Can they give me permission to chat to that person after they've seen the horse? So the owner doesn't have to literally relay every single bit of information word for word. It's just more getting their permission to do that. So for instance, I do work very closely with Kate on cases. We'll have chats frequently about those cases on the phone just between us, but that's always with the, you know, the owner's permission, as it were. We do have the odd WhatsApp group, which again, that's what I was going to get to, is that we don't encourage that for every single horse we see, because it would just be too much. You wouldn't be able to give that time to those individuals if that was the case. But a really big case that you're working on long term, we do sometimes create a group between us and just make sure that everyone's copied into the progress, or at least have an update every month or something like that, you know, if there's something pertinent to discuss.
Because at Rosdale's, you're not just treating racehorses. As an ambulatory vet, you'll be treating a lot of non-thoroughbreds and a lot just who are used for leisure and low-level sport as well, wouldn't you? Absolutely,
yeah. Majority of my work is that side, absolutely, yeah, non-racing.
And in terms of just providing guidance to owners, and you say you take on that role, which is obviously great, but as you say, it's impractical because you'll be treating hundreds of different animals. What guidance do you give to owners to make them, to empower them to be better facilitators of that?
Yeah, I suppose that the one thing is for them to keep a bit of a sort of a system, really, whether that's, you know, some people I suggest they even keep a diary if they need to, or to keep sort of photographs, to keep information in one place where they can then pick up and give that to the professional that's there at the time and give them the information they need. I think it does require them to put in the effort and take the interest, I suppose. It's a vital part of horse ownership that I think is easily neglected, or people are just unaware of it, I suppose, the importance of it. So I think it's something they have to just learn and develop.
Brilliant. Kate, so sometimes, I mean, you'll often give out assessment forms. So, and that, you know, that might be the physio, the osteo, the dentist. How often do you see assessment forms from other allied professionals? And do you think it would be helpful if you could see more of those during your course of treatment?
Yeah, definitely. It depends on who's involved, to be honest with you, and to what extent. I think probably less commonly do I see other people's assessment forms. I very commonly see all the vet reports and any imaging and everything that's necessary. But from other musculoskeletal practitioners, saddlers, I think I probably see the most reports from, in terms of the shape of the horse's back and everything, which is really helpful for me. People highlighting asymmetries and then thinking why that's the case. Is it pathological, or is it just one of those things, and, you know, liaising with vets as needed. I think the more information we have, the better, to be honest with you. So if somebody else has picked something up, I'd rather know about it than not.
And James, for you, I mean, how often does that happen? And can you think of situations where, you know, actually what you were doing, the treatment you were providing, could have been better if you had sort of prior knowledge, but before treating the animal?
Yeah, definitely. Working at the front end of a horse, you often get in that situation where you're elevating the horse into an uncomfortable position. And when you start feeling resistance to that, you start thinking to yourself, has this horse seen physio, or has he seen any sort of specialist in that area? And we do have a couple of physios and chiropractors around us that I work closely with. Often people find with their horses, when they get tension in the rein, it's an automatic presumption that there's something wrong with the horse's mouth. And on checking that, sometimes there is, sometimes there isn't, but often we find, is certainly in my practice, we find a lot of problems with horses who have ongoing issues through their lumbar region or through their sacroiliacs that act out into that hand that the rider's holding. So the information that the rider's getting is always going to feel there's something wrong with the mouth because they're feeling it in their hand, where in fact often that case can be fed back to the physio, and the physio then can act on that accordingly, and vice versa as well. Often we find horses with pole issues, and that can lead to good dentistry discussions, and we find issues in the mouth that can lead to that TMJ being locked backwards, which is given the pole issue, which is then falling down the back. So working very close with physios and chiropractors is a really important part of our job. But we do have a really good charting system within the BADT. where we can photograph a lot. It's all electronic and all be fed through email systems to vets on photographs of fractures or any problems like that. And also that can be fed back to the physio or the chiropractor section, because obviously shapes and forms in horses' bad pathology can affect the way the temporomandibular joint sits, and then that can all be fed back, which then helps the physio to understand why that horse might keep getting that same problem reoccurring over and over again. So yeah, it's quite important to have that swap over of information for us.
And Becky, in your experience, how does that best work in terms of getting that crossover of information between the vet and the other allied professionals? Sorry, you're on mute, Becky.
So I think the crossover of professionals is important for the welfare of the animal. Quite often, if horses have certain problems with limbs or things like that, it comes out in the shoeing, the behaviour of when you shoe. So you might opt to do it slightly differently. So yeah, it's very important to have that crossover between the professionals from a horse welfare point of view.
Brilliant. And how many WhatsApp groups are you a part of in terms of treating different animals?
Yeah, quite a lot. Different owners, vets, trainers, head staff, all sorts. Yeah.
And I suppose you see, because people can be too engaged and actually interfere, and they can be completely disengaged, and that creates a different problem. So are there particular techniques that you can do, sort of undertake to sort of balance that?
Yeah, I think sometimes it comes down to the knowledge of the person as well. Sometimes if they're a more professional person that knows a lot more, they can become over involved. But if they're new to horses, they might not understand the severity of things. So then they need sort of pushing along a little bit more and have a little bit more help. So yeah, sort of the crossover is vast, really. Yeah.
Brilliant. So Lucy, just to turn to a few more specific questions. You sort of touched on this, but who is allowed to prescribe, supply, stock, and administer different types of sedatives and painkillers? Sort of two very common medications in the care of our horses.
So legally only vets. Vets are the only ones allowed to purchase those things in order to sell and to prescribe them as well. We can obviously prescribe things like oral sedation that the owner can then use themselves, but it's important we know what that's being used for. So you know, the worst case scenarios that I've come across, for instance, would be people saying that they want sedation to clip the horse, but actually it's for an unqualified equine dentist or somebody to do some work, and that's not allowed under the rules. And obviously it's also misleading me by telling me that for the assumption which they're getting those medications. So it's important those things are controlled for that reason, because they can be really dangerous in the wrong hands at the end of the day. That's the reason behind that.
Absolutely. And so what could someone do if they were aware that that was being abused?
That does, I mean, it depends who's doing the abusing. So if an owner is being misled by the, say, let's unqualified equine dental, dentist person, then that they need to speak to the vet about that, obviously. And the vet, if it's the, sorry, I haven't said that very well. There's no one to report that person to, as I mentioned. That's the sad thing. So, but we can go to the Royal College of Veterinary Surgeons to mention that there is somebody out there doing this sort of thing. That would be the best place to start, really, is to speak to the vet.
Brilliant. Brilliant. Thank you. Kate, Lucy did touch on this, but what do the different qualifications for musculoskeletal practitioners mean? And why is it important for these before choosing who to use, to know about these before choosing who to use, in your view?
So the different qualifications normally define which profession that you belong to. So whether you're a physiotherapist, an osteopath or a chiropractor, and the degree of training that you've had in order to achieve those qualifications. So I think it's important to have a knowledge of what your practitioners' qualifications are, because if anything was to go wrong, you need to know which regulatory body that you need to approach. You need to ensure that they're not going to do any damage to your horse. That's probably the primary thing as well. And that person that you've chosen will be open enough to discuss with the vet if there's a particular problem. I think because the titles are unrecognised or unregistered, that makes it very difficult, because someone can do so. I've done over 5 years of training to become a veterinary physiotherapist, but because my title isn't protected as a veterinary physiotherapist, somebody could have done a weekend course for 50 quid and call themselves the same thing. And so I don't really think that that amount of knowledge or experience is comparable. So it's important to make sure that you're getting the right experience from the right person.
Absolutely. So, Becky, if my horse doesn't wear shoes, it's kept barefoot or without shoes, does it matter whether I use a barefoot trimmer or a farrier? You need to come off mute again.
Legally, it doesn't matter if you choose a farrier or a barefoot trimmer. I can't really sway you either way, but I can tell you the facts. Farriers study the horse's anatomy and physiology in depth. They cover all shoeing techniques, all ailments, how often, how to shoe and trim for them during a grueling 4-year apprenticeship. They are tested both practically and theoretically every 6 months to be able to progress to the final exam. This is coupled with case studies, portfolio work, an MVQ evidence of all their work, full-time supervision with an ATF, practical supervised practice for 4 years. So that's approximately 8,320 hours of learning. That's without any extra hours put in at competitions, clinics that are attended by the apprentices. The barefoot trimmers can do a 3-day course to qualify. It's described as a basic trimming course. Equine podiatry courses consist of 23 days in the classroom, 12-day practical, 200 hours of home study, 8 case studies, and 4 days shadowing a senior, which equates to approximately 328 hours of learning plus their case studies. Barefoot trimmers don't have a governing body, so it's difficult, if not impossible, to claim on insurance if something was to go wrong. So I guess it really depends on whose hands you want to trust your horse's soundness and career longevity to, really.
Absolutely. Thank you. And I'm sure there'll be questions on that, Becky, but thank you for that. And James, again, Lucy's touched on this, but briefly, what can equine dental technicians do and not do legally without a vet being present?
So basically, we look at horse's pathology and horse's mouth. So corrections, or to the pathology itself, like overgrowth or hooks, ramps, ATRs, things like that. So imperfections in their sort of pathology of the horse's mouth, we can correct those using power tools or hand floats wherever appropriate at the time. We can take wolf teeth out legally, but we have to have a vet present, and that's really useful because we want them sedating anyway, so it works hand in hand. And apart from that, we can take deciduous teeth off, so baby caps. We can take loose teeth out as well. So we have quite a broad area. My area sits a little bit narrower than that. I always sort of get to the area where I say anything that involves any amount of blood is certainly the vet's area. So I have that clear definition for me that if there's blood involved, it's a vet's job. So it makes it really easy to understand.
Brilliant. That's a good, great analogy. Lucy, why does a vet need to give permission for some professionals to treat my horse, but not others? So I don't need a vet approval for a farrier to shoe my horse, but I do for a physio.
Yeah, that's to do with, so the farrier isn't involving diagnosis of anything, and it isn't involving treatment of anything, as it were. That's a routine care of the horse. They're under their own act. They're legally allowed to act under the Farriers Act. I'd mentioned it before. So the physio thing where you need permission is to treat a horse with a condition. And that's the really clear thing we're talking about. We're not talking about routine maintenance of the foot or routine musculoskeletal kind of massage or therapy. We're not talking about routine dentistry of an individual horse. Where permission is required is where the horse has a problem, and that problem needs to be clearly diagnosed and will have a clear treatment. And that's never going to be a simple thing for anyone to do. The vet has to legally be involved. And so that's where the physio permission to treat thing has come from. It's very specific.
Is that differentiated the same with Farrier? Because obviously you say Farrier can be routine, but it can also be part of a treatment regime. So is a Farrier who's therapeutically shoeing a horse, does that require veterinary involvement?
No, it doesn't. No, they're sort of, they have autonomy, as it were, within their profession to act within their field. Yeah, sorry, I missed your point there. No,
but it's obviously preferable for the vet and Farrier, because it's not it's possibly not just going to be the Farrier element of the treatment that is going to be relevant. There's going to be physios and what else, others involved.
Yeah, I think there's very rarely, I can think of, very few cases where there is actually one profession ever involved. So often, if it's anything to do with lameness, there's nearly always a Farrier and a physiotherapist or such like involved. If it's to do with the mouth, it nearly always has to involve vets, EDTs that are working in that field. I think it's impossible to try and separate these things out, actually, in most cases. And there's always secondary problems that are having knock-on effects, like we've just alluded to. The horse can't tell us, I've got a little bit of a pain here. By the time we know there's a pain going on, because they're so stoic, there's often other things having gone on anyway. So there's rarely a single problem that we're dealing with on its own.
Brilliant. Having chastised everyone for not asking any questions, there's now loads, but we have a few more questions to get through here just to help set the scene. Kate, I love this question. If I suspect my horse has a sore back, do I contact an equine physiotherapist, a chiropractor, an osteopath, or a masseuse?
None of the above. You contact your vet. If it's a primary problem, if it's the first time it's occurred, absolutely 100% needs to be your vet first. It may be a primary back problem, but chances are it may be another underlying issue, most likely lameness, which needs to be diagnosed, treated, or ruled out of the above before any musculoskeletal practitioner dives in, because if there's an underlying problem like a lameness, for example, it doesn't matter how much treatment you give from a musculoskeletal point of view, it's very unlikely that you're going to cure that lameness, and all you're going to be treating is the secondary effects of that lameness, which aren't going to go away if the primary thing isn't dealt with. Once that's been decreed, if you like, or sorted out, then whichever musculoskeletal practitioner you prefer to use whichever one you prefer. Some people prefer osteopaths, some people prefer chiropractors, some people prefer physios. It's literally personal preference.
And James and Becky might want to come in on this, but I mean, in your experience, have you found vets can it be a difficult relationship with the vet, because in some ways they're the start of the process when you're talking about therapy and treating a horse?
Well, from the equine veterinary from the dentistry point of view, for me, there's no emergencies in equine dentistry from an equine practitioner from my end, because if the horse isn't eating, or the horse has got fracture, or the horse has got something drastic going on, it's a vet situation straight away. So if I go and they say, well, I've got emergency, my horse isn't eating, I go and look at that horse and I rush out there and I move clients and I go and see it, and the horse open the horse up, yes, it's got a fracture, you have to go and see a vet. So it's a real simple line for me. If the horse is in an emergency situation, then always contact your vet first, because that vet will be needed whatever process takes place, whether it's something's gone drastically wrong in the horse's mouth, or there's been an accident. Whether that vet needs there only to sedate that horse, it still needs to be a vet process first. So for me, it's really simple. If that people are ringing me for emergency cases, you just pass them on to the vet straight away. The relationship, I'm very lucky in relationship with the vets around me. We have a very good relationship. They don't like doing dentistry and I don't mind, so it works really well.
Becky, any experience from yours?
We actually have a really good relationship with vets and vice versa. I think it's becoming apparent now that the relationship between vets and farriers has to be a good one for the best horse interests, really. And if, again, along the same lines as James, if there's an emergency situation, you're always going to want a vet there. And equally, the vets might prefer a farrier to delve into something that they sort of don't want to, or advice on shoeing for, I don't know, laminitic or something that's got problems on x-rays and things. So yeah.
Brilliant. Listen, before we open up to open questions, same question, I don't normally do this, but to all of you. Lucy, what can you do if you have concerns about the vet one uses?
I think, yeah, the first thing is to try and talk to the person. I always say that. Do try and, if you can, have an open dialogue with the person you're concerned with. There might be an easy explanation for what's gone on. Next level would be to talk to their practice and try and get somewhere that way. But overall, if there is an issue that is much more sinister, or you need to take it higher than that, then the Royal College of Veterinary Surgeons is who accepts complaints from the public and will deal with them as appropriate.
Brilliant. Kate, from a equine physio perspective, what happens if you've got concerns about equine physio you're using?
Again, much like Lucy, try and speak with that person directly initially, and then you would be going to whoever musculoskeletal practitioner's regulatory body. So for me, it would be ACPAT or the Chartered Society of Physiotherapy, or RAMP, so the Register for Animal Musculoskeletal Practitioners. If your therapist is allied to a particular vet practice, you could speak with them as well. But generally, whoever is regulating that person, which is why it's so important to pick somebody who has been qualified, so that you have somebody to go to, should that be the case.
Sure. Becky, anything to add from your perspective?
It's just, for us, it's the Farrier's Registration Council. If you can't sort of approach your farrier first, most of them work on their own. So yeah, the Farrier's Registration Council. Okay,
and James?
Yeah, the BADT is the only association that has a complaints process, and that's available online to general public. We have a dedicated complaints officer that deals only with complaints, and they go and then sit to a panel of council members, and if we need to escalate that up, we then have a panel from the RCVS, which sit half, from BEVA, British Equine Veterinary Association, and ourselves, which then decides the outcome of that case. So,
brilliant. Okay, so now thank you very much, team. You've been brilliant, but your work's only just started, I assure you, because we've got some brilliant questions. Please do carry on sending them on the comments function of Facebook or on the Q&A function of Zoom. So the first question, and Becky, I'll put this to you first, from a Facebook user: what happens if my vet and farrier disagree on the diagnosis?
A diagnosis is down to the vet, really. Farriers aren't allowed to diagnose, so you have to come to a cumulative decision together to decide what's best for the horse.
Okay, very good point. So obviously the diagnosis absolutely is the veterinary thing, but Lucy, what happens when they disagree on the treatment protocol?
I try to negotiate and discuss it, because I don't ever dismiss the farrier's viewpoint. You know, the farriers at the end of the day often have been, like you mentioned, shoeing that horse very, very regularly, know that horse really well. So I try to understand their viewpoints. Obviously, if I really disagree, then I have to be honest with that owner and say, I really don't agree with what the farrier is advising. And then it ultimately is the owner's choice with who they go with. But I absolutely try and discuss that with the farrier and try and understand their reasoning for why they disagree or what their thoughts are.
And Kate, being part of a veterinary practice, hopefully that kind of situation within the physio world is minimised. But are you aware that that's a regular occurrence out there in a big bad world?
What, between farriers and
no,
vets?
Between physios. Sorry, the equivalent.
Between physios and vets. Yeah. I would say it is pretty rare, to be honest with you, because we work directed by the vet, and to a certain extent it's unusual, I would say, that I would disagree with anything that a vet's diagnosed. I might have a slightly different viewpoint. I don't just work with Rossdales, I work with a lot of the other vet practices in the area as well. It's just that Rossdale's happen to be the primary vets that I work with. But no, generally it's a very open discussion, and we decide which way we're going to go between us and the owner.
And James, have you often had an experience of disagreeing with what the vet's saying?
Not particularly. My only problems I have a slight issue with is making sure that the problems we come across are dealt with by the correct person. And by that, I mean, there are specialists or advanced practitioners in certain areas which are very, very good at what they do. And they not only deserve that referral, but they are the best people to be treating that horse. So I do also think that sometimes there's a discussion between the primary vet and where they're going to send that process on to, because just because they go, we don't deal with that, we can send it down the road to the other veterinary practice, doesn't mean the other veterinary practice has also got somebody that has a specialist or an interest in that area. So it's quite important that the owner understands, and this is sometimes where the problems occur, that just your local vet practice, even though it says on they can do equine dentistry or they can treat category 3 procedures, doesn't mean they're proficient in doing so. And that's something that Lucy tapped on to earlier when she said within your area of competency. And that's quite important, that and that's usually where I step in and sort of say, look, these are the guys that do it as a profession, and they do equine dentistry only as a vet. And these are where this complicated case needs to go, rather than 2 or 3 people sort of playing at an idea and a few x-rays here and £500 later, and then actually go straight to where it's important and then get the job done properly once. So
yeah, very sage advice. Thank you. Becky, a question from Rebecca, who's asked, do horses that are barefoot have a greater percentage of joint or muscular issues than a shod horse, or vice versa, in your experience?
That's a difficult question to answer without any sort of scientific study behind it. We do quite a lot of barefoot and shod horses, and I wouldn't say there's much difference in the rate of joint and muscle problems between a shod or an unshod horse. But as I say, without the scientific knowledge behind it, it's hard to say.
Case selection, I suspect, as well, making sure that you're choosing the right horses to go barefoot or shod. I think it's prevention, isn't it, as well? Yeah.
So I've always disliked the term barefoot. It's either shod or unshod, and I think that's it. For me, that just makes it clearer, because there's a reason, and there's lots of horses that are shod in front and unshod behind, aren't they? I mean, it's horses for courses, isn't it? And that's the critical part of that.
Absolutely, but it's the same if you think about it from a human point of view. Not everybody runs in the same trainers. So some people run with an arch support, some people don't. Some people prefer barefoot running or with a highly supportive shoe, and that depends on your biomechanics and what's the right thing for you. And it's exactly the same for the horse. So you can't say all my horses go barefoot, because that might not be appropriate for every single one of those horses. So I think exactly, horses for courses.
It's not the choice, is it, of any of us lot, actually, whether that horse is better shod or barefoot. It depends on the horse. The horse needs to make the decision, as it were.
I'm showing my age now, but I think she became British, but was she South African or Zimbabwean? Zola Budd, she ran in the Olympics in bare feet, didn't she? Seemed to knock out an American runner, as I seem to remember, but there we go. That's another story. So here's an interesting question on Facebook. Lucy, I guess one for you, but others might. There are an increasing number of sheath cleaning businesses around. Is there an associated qualification in this field, or association members to check for as owners?
Yes, interesting. So it has become a bit of a popular, I'm not sure what the term is, career path for some individuals to go around cleaning horses' sheaths. My big concern is these people sometimes haven't had any training. In fact, I think invariably, I don't think I've met anybody that's been medically trained before they do that job. So they could do more damage than they realize they're doing. And that's the worry with anyone that's not done any training, is not whether they're good at what they do, it's whether they're aware of the damage they can cause unknowingly, because they haven't got the information and the knowledge to be fiddling with that part of the anatomy, as it were. So unfortunately, there are cases where sheath cleaners have caused severe damage to horses penises. So I am very cautious about people doing it, and actually over cleaning sheaths is absolutely not okay. I think if there is a problem with a horse's sheath, the vet needs to be involved in diagnosing why there's a problem with the horse's sheath, because a horse shouldn't need regular cleaning at the end of the day. So if there's a problem, it must be diagnosed why and what's going on, and the treatment be appropriate. So
in your view, Lucy, should people clean their horses' sheaths annually, or should they just leave it? And I mean, is there... Same
as the shod, unshod thing. Every horse is different. Some horses never need to be touched. Some horses do need occasional cleaning with the right, chemical, as it were, the right concoction solution. And some of them do get recurrent infections with yeasts and things, and they do need actual proper treatments, but there's a reason presumably why they're getting those infections, and that needs to be dealt with. They might have Cushing's, for instance, so it's important to diagnose the reason if they're getting a recurrent issue. But no, on the whole, I don't think sheath cleaning is normally required.
Jan Woodall has put up a comment. Barefoot has many advantages, and I think we'd all agree with that, don't we? I mean, going unshod can be absolutely. There's many advantages to do it, but as you say, Lucy, it's horses for courses, and choosing, how you're using your horse, or you're working with your horse. Now, EC's asked a question: what is the best way of sharing information between all the horse professionals? Has anyone got anything additional to add there? Because I think we've broadly covered that question, unless anyone's got anything additional to add. Not seeing any, so we'll move on then. Next question, again from Facebook. My horse needs to be sedated to have its teeth done. Does this mean I should only use a vet to do its teeth? James?
Oh, that's a great question. And we get this a little bit at the moment. Lots of vet practices sort of set up into equine dentistry recently. And for me, it's a clear line. You have to check that practitioner's qualifications in that area. Just because they're a vet doesn't mean they're proficient in doing horses dentistry. So for me, I feel that they have to have a relevant qualification to prove that ability, and then it's an okay process. And we meet lots of vets who go out there and started their post-grad stuff and have never touched a horse's mouth in their training at all. And we meet some vets that have done lots of theory in universities in their degree courses, and we meet some vets, postgrads, that have done a little bit of practical. But when you compare the sort of the practical training a student gets from the BADT compared to a veterinary degree student, it's just not comparable. We're seeing 2,500 horses a year. My students will, in the space of the 2 to 4 years of getting their qualification, will see nearly up to 10,000 horses' mouths in that time. And we're working on probably at least 1,000, if not 2,000 them in their second part of their education. So by the time they're proficient doing what they do to get their qualification, they are far, far beyond that skill level has been produced already. So just because they're a vet doesn't mean they're competent doing an area. And that's quite a hard thing to say. I'm sat here in front of Lucy, but I think she'd probably agree. There's certainly an area for everybody to do. And I think there is an area where vets, just because they sedate, they think they should take the teeth as well. And not always the case.
Lucy, anything to add to that?
I guess, yeah, I mean, in the veterinary defense, I suppose, playing devil's advocate, we've been trained in anatomy, pathology, and I know the practical skills and how many teeth you've done does come down to the individual. There are absolutely going to be vets out there that are doing multiple other things day in, day out, and they might not be racking up the numbers of teeth. I think there's equally, though, some vets out there doing a lot of teeth. I mean, I don't do as many as other members in my team do, but there are vets out there doing a lot of teeth with a lot of interest who don't necessarily have the certificate. But like anything, it's how good these people get doing the job and knowing, I think, how competent they are. And that's my worry, is we can all say we're competent and have the qualifications, but we can all slip. We can all become bad at things if we don't keep up our competency. The competency really comes down to the individual, and actually a vet that's going out doing lots of teeth and is doing a bad job, I would hope would get reported to the Royal College for doing so and would be pulled up on it, much like any of us, I think, would hope, any individuals in our profession. If we're doing a poor job of something, I hope that we'd A, recognise it, and B, if not, if we're doing any damage and doing any harm, then that gets spotted and we are
That's quite an interesting point, because often the problems with horses' mouths is very unseen because it's a very closed subject. Once that person closes that horse's mouth, nobody else can, particularly unless you've got a gag and a really good light, can see what's going on. So once that sort of situation's passed, that opportunity is often missed. Also, often I find that people, because they have been trained maybe by somebody at their own practice. This sounds like I'm vet bashing here, but I'm not at all. It's just only the experiences we try and explain out. But once the vet often only gets their experience through another member of their vet team they're working with at that practice, and often they've not had training either. So often we find that the competency that they're trying to achieve, often they don't understand what they need to achieve in the first place because they've never really been shown properly, or never had somebody externally look at their work and say, that's the required standard, well done. So they could go around doing lots of horses' mouths in lots of practices, but are they truly doing it correctly? That's the question I must ask. And whether that's a vet or an EDT, they're all equally in that area. But I do find it, vets do have this persona because they're a vet. They seem to think that they'll be better at doing a horse's teeth, or the owner has that perception they'll be better doing horse's teeth or not. Right. It comes down to, have they achieved some kind of standard or recognized standard to say somebody said that work is what's required, and that's really where it sits for me. Whether that's a lay dentist or a vet.
Because the question, because a lot of people are lone practitioners. I mean, Becky, a lot of Farriers are lone practitioners, and a lot of people, I mean, me included, I would have an annual appraisal of my work, and part of my training and development, and I mean, how does that work in the Farrier world, where people are they annually appraised?
So we have to do CPD every year, a minimum of 10 points. Which sort of keeps our training ongoing. I work with my partner, and we're constantly looking at each other's work and picking up different things where we can improve. Obviously, I train apprentices too, so you're constantly looking at your own work and your apprentices' work. And I think it sort of comes down to self-worth, really. You have to be critical of yourself, and realize if you haven't done a job quite as well as you wanted to, or the result hasn't come straight away, so you need to work on it for the next one. It's difficult when you work on your own.
I'd imagine there's a lot of people saying you're very brave, asking your other half to assess your work, and that's a whole nother level of love it. Listen, Kate, Rachel's asked, have the panelists any thoughts on the impact on the reputation of your profession by unregistered and unqualified people?
Yeah, that's quite a tricky one. As in, the reputation of a physiotherapist, for example, as to somebody who is not qualified. Yes. I think we just have to keep doing the best job that we can in our own profession and not stray outside of that profession. I think we have to have a degree of professionalism, and not try and be encompassing to everybody. And just as long as we continue to promote our profession and do a good job, I think that's probably the best that we can do.
Brilliant, thank you. Lucy, Fiona's asked, I've spent most of my life around top-level riders and trainers, but now I live in the middle of nowhere and a team effort has seemed impossible no matter how hard I've tried. Is there a way to encourage all our professionals to become a team?
I think it's difficult. It depends on the individuals. You can't force them, can you? If they are not engaging with each other, then how do you create that? I don't know. I mean, I certainly have owners that manage to encourage that out of even some very tricky individuals who aren't particularly keen to discuss and socialize about what's going on with this horse with other professionals. But I think if you're trying, Fiona, I'm not quite sure what the answer is, because there's no way of forcing them, is there? I mean, I would hope that those individuals see the benefit of working together, but perhaps you're very unlucky with the ones you've got. I don't know if you have any options to change. It sounds like you haven't. Anyone else got any?
Yeah, so coming to each of everyone, just a piece of advice, Fiona. I think there's two facets here. One is to the general sort of joined upness, but the fact that she's living in a part of the country where there's not a lot of choice. James, any thoughts from you on that? And I'll come to the other two.
WhatsApp group, definitely.
Yeah.
No, it's really difficult, and I think you'll find that also generally with practitioners, certainly from an equine dental perspective, and I will drag Rebecca into this as well, as a farriers, they do sometimes have a bit of a prickly reputation, and it's very easy to they seem quite standoffish. And I think a lot of the time, we touched on it very quickly earlier when we said about lone practitioners. It's very easy to get in your own little world and do your own little thing. And actually, when a customer sort of asks you a general question, you just be quite snappy and to the point with it, rather than actually just sitting down and understanding that somebody's a little bit concerned about their animal, and there's more to it than just getting your job done and moving on to the next animal. So I think it's quite hard when you're in that situation where there's not many practitioners around you and you are a little bit isolated. It does come down to an individual to try and ease those situations and try and make the relationship a little bit better, but it's hard, very hard.
Yeah. Kate, you better be careful. James has had a bit of a dig at vets now.
I think I've done the whole of the top row so far, so I'm coming down to Kate next.
Love it. Becky, what thoughts from you?
Maybe contact the veterinary practice and see if there's any allies that they work with that they might recommend, or because there might be a farrier involved with the local veterinary practice, or a physio, dental, that they might recommend. And then if you've got a team ready built there already, then you're winning, aren't you?
Yeah. And Kate, anything to add to that?
I think it's already been covered by everybody. I think just speaking to each individual practitioner, asking, are they happy to discuss their findings or send an assessment, or would they be happy to be part of a WhatsApp group or something like that, just to try and encourage a bit of discussion. Or what's your opinion? What do you think the vet has said? Or have you spoken to the vet about it? Or have you spoken to the farrier about it, the saddler, the dentist? Just try and keep facilitating that as much as possible. We all have groups that we're on, check and see whether there are other practitioners. We're generally very happy to share information with anybody. So I think, just keep asking.
I do want to just chip in there, sorry, because I suppose it is depending on the problem, isn't it? I mean, if I got messages from all my clients every time a horse was shod or had been seen by the EDT or had the physio out, it's not tenable. You can't do that. So make sure you are filtering the information that's required to the right people at the right times. Otherwise, you might lose those people altogether. I'm not suggesting that's what's happened with you, Fiona, but I think it is making sure that maybe that's where a good place for the vet to be put, actually, as you mentioned, Rebecca. If the vet thinks that you need to get the Farrier, Physio, EDT on board, then the chances are you do, and therefore that's where you start. Perhaps I think if your vet's perhaps not got the desire to share information, doesn't think it's necessary, then maybe that's overkill, as it were, for communication. It's getting the balance right, isn't it? Otherwise, not everyone can do their jobs well.
So keep communicating. So don't give up. Communication is obviously really important. Use technology, WhatsApp groups or whatever it be. I hope, Fiona, it's given you an idea. You've been very patient. You asked a question 3 times, and I'm sorry for not seeing it, so apologies for that. The question from ET again about regulatory systems and qualifications for horse professionals in other countries. Lucy, that's probably one for you.
Sorry, repeat that question, Rowley.
How can all horse owners find out information about regulatory systems and qualifications for horse professionals in other countries? I just think it's especially relevant post-Brexit. Yeah,
absolutely. You literally would have to, I mean, if you were looking to get some suitably qualified professionals in France, for instance, I would probably contact a vet practice. I mean, bar trawling the internet and looking at all the numerous things, which I can say from trying to do this presentation will take years off your life. I would go to maybe a vet practice and see because they will automatically know, I would hope, what those sort of situations are in their own countries. So that might be a good place to start if you're looking at a specific country.
Brilliant. Okay, thank you. Yeah, Kate.
Sorry, just quickly, I know certainly our governing body, ACPAT, we have members all over the world. So if you've got a governing body of that particular profession that you want to go to, it will be a good place to start there, because they may be able to direct you as to kind of a neighbouring governing body in another country.
Perfect. Thank you. We've answered Rachel's question on reputation about unregistered, unqualified people. Next one is from Facebook. I love this one. I mean, James, maybe you want to start. Has the pandemic enabled allied professionals to all work together virtually? If so, will this continue as we come out of the pandemic?
That's a good question. All of us have upped our game when it comes to our IT skills. And mine is still very limited, I can tell you. But certainly, I think that it's certainly helped. And certainly it's helped the vet profession enormously, because they're such busy people. To try and feed all those little pockets has been quite difficult. And so I think it's helped facilitate them. From our own perspective as a dental practitioner, we have quite an amazing app that we run on our iPads, which allows us to share information really easily. I talked about it earlier, but we can share. Often I do a lot of photography of the horse's mouth. We take pictures and send, and it can be sent with the chart at the same time. So it's very easy to get information or ideas of information from your vet allies quite quickly by simply WhatsApping information, or like I said, through our app process. So it has helped massively. But I think it's probably something that should have been happening a long time ago, and the pandemic's pushed it into place a little bit better.
Brilliant. We're getting towards the end, and you've been brilliant at questions, and I'm sorry, I thought I was confident we'd get through all of them. We're not to. But so we're just, panelists, I'm going to try and get through a few more, if we can just keep our answers as tight as possible. Lucy, I'll come to you first on this one rather than Becky. How can we lobby to have Barefoot Trimmers registered?
Crikey. The Barefoot Trimmers need to do it, basically. They need to come together. They need to approach the Royal College of Veterinary Surgeons and the Farriers and all the people involved to come together with a plan, basically, and then that needs to be approved. It's quite hard to get these things done, but they need to do it themselves. Absolutely. Becky, anything to add to that?
No, I think it's all covered, yeah.
Yeah, and obviously the government department is DEFRA, the Department of Environment, Food and Rural Affairs. Getting new legislation and regulation is a tough gig, especially post-Brexit, but hopefully that's helpful. Really good question from someone here on Facebook. Maybe Kate, I'll ask you. Many people have small budgets. There's lots of allied professionals. How can we make sure that people spend their money on proper care and not frivolous care?
Oh, that's an excellent question. I think pick your practitioner. Again, I'm going to push the qualifications, make sure you pick the right practitioner from a qualification point of view, and keep the channels of communication open between your vet and your practitioner, and then you would have the whole package together.
Brilliant. Another really good question from, sorry, I don't know your first name, but talking about, a lot of people, especially Farriers, working alone. Is there mental health support available in any of the professions specifically for those professionals? So, Becky, do you have any mental health support through the FRC or the Worship Company or anywhere else?
There is the BFBA, which you can approach for different things. I'm unsure as to whether they do mental health problems. I have a private healthcare plan myself, but so other than seeking help from your own doctor, I don't think there would be, no.
Fine. Question. Thank you very much, Becky. Kate, question for you. Do I have to use the physiotherapist that is linked to my vet's practice?
No, not at all. Every physiotherapist out there will be essentially a practitioner on their own and in their own right. And so you can use whoever you want.
Lucy, thank you. Lucinda's asked, I'm a Masterton method practitioner registered with IATF TT. Farriers and vets have told me that they cannot refer me to clients if they suspect a muscular condition. Is this because I'm not a physio?
No, it doesn't have to be a physio that we refer to, but we are advised to refer to RAMP members. So if that is a member of the RAMP register, then yes, you are, in theory, able to take referral for work from vets.
Brilliant. And James, just picking up on something Lucy said earlier, how does the horse owner identify which information is important to share with which horse professional?
I think that it all depends, again, on the vet diagnosis. If the vet gets the diagnosis of the horse right, then they can feed that information down to the relevant party, and then they know which direction to go in.
Brilliant. Thank you very much. Listen, thank you so much for your questions. We're coming to the end now, so I'm going to do 3 more questions. One from Laurie, question concerning physio and manual therapies. I'd be interested in practicing abroad, especially in France. Do you know if some governing bodies have an impact in France or countries around, and are there any qualification recognition issues? Kate?
It would be each country individually will have their own laws over what their practitioners are and aren't able to do. For example, in Ireland, you don't have to have veterinary consent to do any musculoskeletal therapy, but you do in this country. So it depends on country to country. I would go to whichever governing body you would like to become a member of and speak with them directly about what they advise to do for whichever country you want to go to.
Brilliant. James, a question from Facebook. I'm about to get my first foal, a 7-month-old Clydesdale. She arrives next week. When and how should I be introducing her to dental work, getting used to having her teeth looked at and wearing the gag, etc.?
So we have a golden rule, or certainly my golden rule, and certainly the association follow that quite strongly unless there's any other issues, but 2-year-olds before we put the gag on them. And that's due to jaw formation, softness in the bones, gentle teeth, so on and so forth. So 2 years old is a good guideline before you should be introducing them to any sort of dental work at all.
Brilliant. Thank you. Question for Becky. The farrier has a very important job. I understand that they're able to see from the shape and growth of the horse's hoof if there is a problem that has not been picked up by the owner, which might be from perhaps a pulled muscle or not being balanced in ridden work. Is this correct?
Yes, certainly you can tell by the wear of their shoes if there's something wrong with them, how they present when you shoe them. If you do a dynamic assessment too, you can tell by the movement, especially if you're the regular farrier, which you would then express your concerns to the owner to refer on to a vet. Brilliant.
Listen, thank you very much. And I'm very sorry for the few questions that we haven't got through. We've got through more than half, but not all of them. So I'm sorry about that. But thank you so much for being engaged. I'm now going to come to each of the panelists, starting with Lucy, and just say, you know, we've talked about a lot of different areas tonight. What would, Lucy, be your take-home message from our discussion?
I think it's just being aware that there is rarely one issue going on. Like I mentioned earlier, I think there's nearly always multiple issues, and it's getting down to what the primary or most significant issue is that's really important, and addressing them all in entirety to get the horse back to working order. So that's why the team is important. None of us can do that on our own, and I think that's really, really vital to take on board.
Brilliant. Becky, what are your final thoughts?
I think a cooperative, collaborative team approach is beneficial to the horse in every way.
I almost feel it needs a third C, cooperative, collaborative, and another C, but I like it. I like it. We'll work on it. Kate?
I think it's important to choose a practitioner that has the right qualifications. It doesn't matter which practitioner you use, as long as they are regulated and well qualified, and ensuring that that practitioner will speak with the whole team and be able to work all together, as Lucy's already discussed.
Excellent. And I love it. You've given us the third C of choice. Well done. And James?
Just a take-home message from me would be just to check your dental practitioner's qualifications. And then you could be a bit more understanding where you're going.
Brilliant, and I think that's a really good, because I mean that apply to all the panelists and all the other allied professionals as well, because they have so much to offer. But it's just, you know, doing it coordinated. And I think someone made a really good point: is don't waste your money either. I mean, it's an area where you could waste a lot of money and no benefit to your horse, which is obviously our primary and your primary concern, which is great. Thank you so much. That's been absolutely brilliant. As I say, if you've enjoyed tonight's webinar, please do let people know and watch it back on our YouTube channel afterwards. If you've got thoughts on what we should be doing for our future webinars, then please do email us on education@worldhorsewelfare.org. We'll be back in a fortnight, 7 p.m. on the evening of Wednesday, the 9th of February, with Chris Tufnell on how to deal with a wound and when to call a vet. And so finally, it's just my pleasure to say thank you to Lucy, to Becky, to Kate, and to James. You have been absolutely brilliant. You've kicked us off in 2022, if I could speak, in brilliant style. Lots of really positive messages coming through, how useful it's been. So you've done the job, and you've done it brilliantly. So thank you very much. Thank you very much for everyone for watching and listening, and look forward to seeing you in the fortnight. Take care.